Women living with uterine fibroids have one major fear that quietly influences their decisions. And that fear is, if I go for a fibroid surgery, will I still be able to get pregnant? Because of that question, many women remain stuck. They know they have fibroids. They may even have symptoms affecting their cycles, their fertility, even their daily life, causing them severe pain. But the thought of surgery feels like a risk they can't afford to take. Sometimes they even avoid treatment completely because the only treatment is surgery. The real question is, what does fibroid surgery actually do to fertility in the first place? Hi, my name is Chinaza. I am a medical sonographer. On this space, it is everything ultrasound. And today, we will talk about fibroid surgery. Fibroids are medically known as uterine fibroids or uterine leiomyoma, and they are benign growths that develop from the muscle layer of the uterus. They do not always cause infertility. Their effect depends heavily on three things: their size, their number, and most importantly, their location. Some fibroids just sit quietly in the outer wall of the uterus and cause no fertility issues at all. But others, especially those that distort the shape of the uterus or extend into the uterine cavity where conception takes place, those ones can interfere with implantation. They can also increase the risk of miscarriage or make conception more difficult. So in those cases, the fibroids themselves, not the surgery, may already be the problem. Now, fibroid surgery, or myomectomy as it is medically called, is designed with one main goal, that is to remove the fibroids while preserving the uterus. It is not a removal of your ability to get pregnant or your womb. In fact, for many women, it is done specifically to improve fertility outcomes. By removing fibroids that distort the shape of the uterus or that affect the endometrium where implantation takes place, the surgery can help restore a more normal uterine shape and improve the environment for implantation. However, like any other medical procedure involving the uterus, it is not without considerations. After the surgery, the uterus needs time to heal, and during the healing process, there is a small risk of scar formation or adhesions within the uterine cavity. These adhesions in some cases can affect implantation or menstrual patterns, but it is important to understand that this is not the most common outcome. Those are the rare outcomes. In most well-performed surgeries, especially when properly followed up, women still go on to conceive successfully. There are also factors of surgical depth. In these cases, fibroids that are deeply embedded in the uterus may require deeper incisions, and that is where healing becomes more delicate or longer. But again, that does not automatically mean infertility. It simply means a more careful surgical technique and proper post-operative care are very important. After fibroid surgery, doctors usually recommend waiting about 3 to 6 months before trying to conceive. This gives the uterus enough time to heal properly and reduce the risk of complications in early pregnancy. In real life, many women who undergo fibroid surgery go on to have successful pregnancies, either naturally or through IVF if need be. In fact, for some women, after removing the fibroids, it actually improves their chances of conception and reduces the risk of early pregnancy loss. So the fear that fibroid surgery automatically ends fertility is not accurate, but at the same time, it is not also a decision to rush without proper evaluation. The key is understanding your case specifically, where the fibroids are located, whether they are affecting the uterine cavity, their sizes, how their overall appearance affects your fertility profile. This is where ultrasound becomes very important. A proper pelvic scan helps assess not just the presence of fibroids, but their location, their number, and their sizes. And after the surgery, it also helps to evaluate healing and rule out any complication. So to answer the question clearly, yes, women can still get pregnant after fibroid surgery, but the outcome depends entirely on individual factors, not just the surgery itself. What is more important is not just removing the fibroids. What is also important is preserving fertility while improving the environment for healthy pregnancy. And then making sure that you are comfortable if your fibroids are causing you severe symptoms, discomfort, or pain. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and follow for more simple ultrasound explanation and women's health education. And I'll see you in my next video.